Professionalism is a vital component of the CASPer exam, and one that you can expect to feature prominently. Professionalism should retain the same meaning no matter what career you are looking to begin, be it teaching, medicine, or an allied health profession. The correct actions to take should be clear to you. However, there will be differences in specifics from profession to profession, and of course, differences in scenarios therefore. We will focus on medicine here. This is a common professionalism scenario for medicine that you ought to be aware of. It will combine elements of empathy, professionalism, and ethics, but should be taken overall as a professionalism prompt. Your consultant has now come to work smelling of alcohol twice in a 2-week period, dressed in the same clothes they had on the day before. You are a final year medical student. Let's look at 3 potential questions. Please speak to your consultant. What context might there be for the consultant's actions? Describe a time when you saw professionalism in action. This could be your own or someone else's. The first question allows us to interact directly with the consultant. In other words, the party who is failing to uphold the standards of professionalism expected of them. The second question requires that we expand on the context behind the consultant's behavior. The third question allows us to demonstrate our own real-world understanding of professionalism. As with the other guidelines in this series, we'll focus on question 1 and question 3 above. These are the 2 professionalism questions that you should have a structure ready for. The second question above relies on your ability to reflect on someone's actions in the broader context of professionalism and involves a significant amount of empathy. You should be aware of the sort of behavior that would be seen as professional and the type of behavior that would not. Some of this will be obvious, as in this question, where a drunken senior doctor poses a clear risk for patient safety. In other prompts, it might be less obvious. We might need to know, for example, that accepting an offer of a date from a patient is never acceptable, as it can lead to a conflict of interest. You should read through relevant guidelines and professional standards for doctors in the area that you are looking to apply to, or for teachers, nurses, etc. Let's look at the first question. Please speak to your consultant. We need to immediately define why we need to speak to the consultant. It is because they are failing to maintain professional standards, and in doing so, they are endangering patient safety. We should explain that we would address the consultant politely, in private, ensuring that we maintain professionalism ourselves. We then need to address the issue with the consultant. Given that patient safety is at risk, we should introduce the problem near the outset of the conversation. We need to highlight that we have noticed concerning behavior. We should acknowledge our role, but clarify that we nonetheless believe it is our duty to uphold standards. We should allow the consultant to respond and ensure that we remain polite and understanding throughout the entire conversation. If need be, we should explain that we will have to speak to another senior staff member to resolve the issue. We should explain that we are happy to support the consultant in any way that we can and empathize with them as much as possible. Let's look at the third question. Describe a time when you saw professionalism in action. This could be your own or someone else's. Introduce the situation briefly and accurately so that the assessor reading the paper understands it immediately. Explain who was being professional. Was it you, or more likely, someone that you were shadowing or learning from? Describe the exact challenges that they were facing in a professional capacity. If it was an angry patient, for example, why was the patient so angry? How was the patient communicating with the doctor? Describe the exact behavior that showed professionalism. Explain the effect that professionalism had on the situation. How did it resolve the problem? Reflect on the situation and outline how you've learned from it, and feel more confident in displaying professionalism yourself in the future.